Hi there, I'm Shawna Robins with Authority Magazine, and I'm also CEO and founder of Respark Health. And today we are doing an interview. I'm doing an interview here with Dr. Wells. We are going to be discussing sleep, all things sleep. I'm such a big fan of this subject, as you know, and how sleep will lead to a healthier, happier life. Dr. Audrey Wells is a leading figure in the world of sleep and obesity medicine. As a board-certified physician in both specialties, her dedication to helping people improve their sleep and their overall health is profound. With her expertise in sleep apnea therapy, cognitive behavioral therapy for insomnia, and life coaching, Dr. Wells provides a comprehensive solution to help people feel their best. So welcome, Dr. Wells. I'm so happy that you're here.
Thanks so much, Shawna. It's a pleasure.
Yeah, so tell me, how did you get involved in sleep?
Wow. This is going to take us back a couple of decades, but to nutshell it for you, I was actually training in pulmonary medicine, which is a very ICU intense specialty. I was really interested in lung transplantation, and so I was taking a lot of call in the ICU. And really just bumping up against my own biological limits for not only staying up all night to take care of patients, but also having an irregular sleep schedule. And I kind of had hints of this early in my life. I just have never been someone who tolerates a lot of variability in their sleep too well. And it sort of became clear to me that I wasn't going to be able to sustain this career path. Luckily, I was able to pivot into a fellowship in sleep medicine. And I was really driven and happy to do that extra training. And it meshed well with my pulmonary background because, as you know, sleep apnea and other disorders of sleep-related breathing are sort of the bread and butter of sleep medicine. So that's how I got into the field.
Wow. All right. So, and tell me how now I see that you, because of your book and your coaching, tell me a little bit about where you're at now as far as your career goes when it comes to sleep.
Yeah, it didn't end with just choosing this specialty. Not only was I getting professional training in sleep medicine, but I also experienced really profound problems and sleep challenges of my own. One was just related to a really profound period of grief that I went through. And I had related insomnia that got all of my attention because it was really difficult for me to function in that state. And quite frankly, it was really humbling as a sleep medicine expert that I couldn't just think my way out of it. I really had to employ tools that I was recommending and do some trial and error to figure out what worked for me. So I kind of walked a mile in my patient's shoes, and I felt that that was so instructive and it continues to be informative of how I practice today. I've always been someone who's kind of DIY. So for sleep apnea folks, I would, try all of the masks and acclimate to them. I'm talking about the CPAP mask. And I would also put myself through the different testing options. So overnight sleep study in the lab, with all the stuff in your hair, and also the home sleep apnea test. And what was interesting about that was that I started to capture the beginning of my own sleep apnea. And just recently, I've had a home test come back with a moderate sleep apnea result, which is a little bit eye-opening. But previous to that, I was pretty regularly tracking as mild sleep apnea. And then, maybe a couple of years ago, it was during the pandemic, I just became really disheartened about where sleep medicine was tracking. And what I see is just a lot of people going in to get diagnosed with a sleep disorder, often insomnia or sleep apnea. But the medical delivery system is not set up to meaningfully treat those patients and support them as they acclimate to treatments, which are usually long-term. So I stepped out to create an educational platform that includes real support for people diagnosed with sleep apnea and insomnia. And I'm really glad and proud to promote that. It's called Super Sleep MD. And that's a place where people can go to get help.
Do you find that more women have sleep apnea than men? And does it express differently in women than men? What are your thoughts on that?
Yeah, it's a really insightful question because historically, the poster child for sleep apnea is the overweight man with a thick neck that snores loud enough to peel the paint off the walls, right? And it's the wife or the bed partner that brings them in. And I see men like this, not wanting to listen to what I have to say until they kind of understand what it can do to your health. So I think that's the poster child. But as we learn more, I'm happy to say that there seems to be some momentum into looking at women's sleep and women's sleep apnea specifically, which presents differently than men. For example, women don't tend to snore as much. And when they do snore, it's a lot of times underreported because it carries the bias of not being ladylike or, kind of being in the more masculine realm. And, women don't tend to drop their blood oxygen levels as deeply as men do. They tend to arouse from sleep. And I think there's some interesting, tangents that can be made with that being a functional state related to pregnancy, for example. So women tend to arouse more from sleep and have the perception that they're just a light sleeper or that insomnia is their main issue. One thing to mention is that the home sleep apnea tests on the market today don't often score for those brief arousals for sleep. And so as a result, women don't get diagnosed as much or their severity level is underreported. So I think that's important to mention for any woman watching this that's worried they might have untreated sleep apnea.
Okay, so what is the best way for them to learn if they have sleep apnea then? I mean, are there any tools that they can have access to?
In general, I would recommend a relatively low threshold to get tested for sleep apnea. Again, because the symptoms for women often, not rarely, but often look different than men. So daytime tiredness, problems with memory, problems with word finding or concentration, mood issues, even just a labile mood. All of these can be signs of sleep deprivation, possibly connected to a sleep disorder like sleep apnea. Home sleep apnea testing is often the first line test modality for sleep disordered breathing. But for a lot of women, this test comes up under reporting sleep apnea. What I'd like the viewers to know is that you can ask for your REM AHI, that's the dreaming AHI, to get a sense of whether your sleep apnea is worse in that dream state. Now, this carries specific implications, one of which is it affects your memory, and it affects your mood, and it affects your risk for cardiovascular disease, which is the #1 killer in the United States. So if you have a high REM AHI, my advice is to go get that treated, meaning you have to use the treatment throughout the entire night. If that's CPAP or an oral appliance or whatever, you have to use it throughout the entire night because most REM sleep occurs in the second half of the night. The problem is that when sleep studies go through an interpretation and you get the results, oftentimes that REM number is diluted by all of the non-REM sleep that occurs. And for that reason alone, women can get the impression that their sleep apnea is mild when that may not necessarily be the case. So I really try to advocate for women to be proactive about specifically asking about the REM AHI.
Oh, that's such a good tip. You're the first doctor I've interviewed that has brought that up. So thank you so much for that. As women age and they go through perimenopause and then postmenopause, do you find that the sleep becomes impacted with sleep apnea, or do you find other things that play a part? I mean, obviously hormone fluctuations and night sweats and, all of those wonderful things come into play, but are there other things too, physiologically, that women need to be aware of?
Yeah, this is something else that I can speak personally to because I am in the perimenopausal phase. And unfortunately, nobody's immune to the effects of perimenopause among women. And when you look at sleep apnea statistics specifically, about 1 in every 3 adult male or 1 in every 3 postmenopausal woman is going to have sleep apnea. 1 in 5 premenopausal women are going to have sleep apnea. And so you can see how there's that increased likelihood of developing a sleep disorder after menopause. And that's because estrogen is a respiratory stimulant. And when you have a fall in estrogen, you lose some of that protective effect. Also, progesterone, which also falls during the perimenopause and menopause phases, progesterone helps to kind of keep you asleep. It's kind of a sedating hormone. And so women can not only get sleep disruption, but the inability to return to sleep. And then you got those vasomotor symptoms or hot flashes that are really problematic in the middle of the night. Interestingly, the sleep disruption happens first, and then the temperature fluctuation happens next. So it's really interesting when I see that on a sleep study. It's not the hot flash that wakes you up. The hot flash follows the awakening. And that's not necessarily clinically meaningful, but maybe to release the blame on the hot flash itself, there's some kind of tie with the sleep stability and hot flash. So yeah, this is a tricky phase for women. And I think really doubling down on things like the regularity of your sleep period, making sure you allow ample time for sleep, but not too much time in bed awake, making sure your surroundings are dark and cool and all the things. These are the practices that are going to help you move through the perimenopausal phase and even on through menopause in the best way possible.
Well, I'm right there with you. In fact, I'm on the other side of perimenopause. I'm 52, so I'm already in menopause, but my sleep, similar to your story, just disappeared. Just
Mhm.
overnight when I turned 47, just disappeared. And took me 3 years to figure out how to get it back. And walking my talk the way you had to walk your talk was very humbling. And but there are so many daytime choices that you can make. I know you just touched on some of the nighttime choices, but I'd love to hear your thoughts on daytime lifestyle changes that women can make that will help their sleep at night.
Absolutely. And, I like to say that as soon as you wake up in the morning, that's when you should start thinking about your sleep period. Because, as a sleep doctor, sometimes I'll jokingly say I'm a lady of the night, but not really. I also address the daytime behaviors too, because we're in a rhythm throughout our day and night. So what I recommend to people is that they get bright light exposure into the eyes as soon as you wake up in the morning, because this helps your brain pivot more quickly and more efficiently from sleepiness to wake. And it sort of sets a timer in your mind such that 16 hours later, your brain is now more likely to want to sleep. And that's a good thing. I talk about with people the effects of exercise during the day, which can really help not only to kind of burn off some energy, some nervousness, and get you out of that seated position that we all are so plagued by, but it also sort of increases the contrast between day and night. And that's really important, not only for your wake quality, but for your sleep quality as well. And then, a lot of times I draw on my obesity medicine training to talk about the effects of food on sleep, specifically meal timing. You want to keep your meals within a certain window of time because your digestion and your insulin secretion are going to be more efficient during waking hours. And you want to leave a nice 3-hour buffer at least between your last meal and your bedtime so that you're not having acid reflux in the middle of the night and your insulin processing is a lot less efficient at night. So no bedtime snacking, no middle of the night snacking.
No glass of wine in the evening before bed.
Ooh, alcohol. Yes. Yeah. I mean, if alcohol is your idea of a nightcap, I'm sorry to say you're telling yourself a lie. Unfortunately, alcohol has a lot of detrimental effects on sleep. The only thing it does is just shorten that that time to get to sleep because it is a sedative. But beyond that, you're really sabotaging your sleep quality. And unfortunately, for many people, that is a maladaptive coping mechanism.
Yeah, very maladaptive. I agree. One of the best things that menopause brought for me is that I could no longer drink wine.
Yeah.
I would get hot flashes. I would
Yeah.
not sleep. I'd be miserable. It was just something that I loved wine, but it had to go away because it was either that or my sleep. I had to make a choice.
The same thing happened to me. And truthfully, once I got used to it, I never looked back. I mean, it used to be kind of like this reward or a celebration or whatever. And, I just don't think of it anymore. It became problematic. The negative effects far outweighed any benefit I was getting with socialization or whatever. So yeah, I really recommend that women, especially in the perimenopausal phase, just take a break from alcohol because it does not seem to work at all.
Yeah, I second that 100%. What type of foods do you recommend that women focus on to help their sleep at night? Are there precursors to melatonin, or are there things that they can do that you recommend as far as food and nutrition?
Yeah, this tends to be a very personalized choice. I think across the board for anybody, I would recommend unprocessed foods make up the majority of your diet. So these are foods that look like they do in nature, that they look that way going into your mouth. They don't have all of the unpronounceable ingredients on the nutrition label. And you really look at portion size and make sure that you're eating a variety of fruits and vegetables and legumes and taking care of your gut. So all of these things are important, not only for sleep, but for health and weight maintenance as well. Sometimes people ask me, are there specific foods that enhance sleep? There's been some industry sponsored studies and some things, in the media like about tart cherries and kiwi. And the truth is, no one food is going to kind of tip the balance toward healthy sleep. It's a composite of what your whole diet looks like and taking care of your gut and the microbiome that it houses. So I really don't recommend anything, one thing in particular, but unprocessed foods, getting high amounts of fiber in your diet and making sure that your portion control is there are all important. And then, as I mentioned before, the timing of your food intake tends to be important as well. So instead of snacking throughout the day, having a couple meals or maybe three, and keeping that end of meal time at least 3 hours before bedtime.
Yeah, that's a great tip. I appreciate that. I know that the viewers will appreciate that one too. Um, so let's now talk about mental health and sleep. I know there's a correlation between the two. I've lived it. I coach women through it. What are your thoughts on, especially during midlife, how can women support their mental health and support their sleep?
Fantastic question. I want to say this is something that I felt as well. And as women, I hope that we can start to talk about it more in public spaces to assure other women that what they're going through is normal or can be addressed by doubling down on some healthy lifestyle practices. The first thing I want to mention is that you might have noticed your brain isn't the same at 11 p.m. compared to 11 a.m. And it's one of the functions of the newer part of our brain, the prefrontal cortex, to inhibit the emotional brain. So sometimes I'll symbolize the emotional brain as my thumb, and the cortex inhibits the emotional brain. When the new part of your brain starts getting sleepy, it gets leaky. And so your emotions tend to come out, and you have a negativity bias that is more prominent in the evening and during the night, especially if you are dealing with chronic sleep deprivation. So one thing to kind of pay attention to is that if you're having a lot of negativity or self-doubt or rumination coming up in the late evening or during the night, you can disregard that and focus on the more positive thoughts that you're having during the day as the real you. Okay. So that other is kind of an artifact of our prefrontal cortex getting tired. That being said, the effects of sleep deprivation are real when it comes to mental health. This includes an increased tendency toward depression, but especially anxiety. You know, things are this way, but they should be this way. That creates tension in your brain. There's a lot of anxiety there. In fact, people can actually have sleep anxiety if they don't feel trusting of their sleep. So I'm glad people like you and others are really highlighting the importance of prioritizing sleep, not only for physical health, but for mental health as well.
Yeah, I would say that the spinning brain in the evening is so common for women, especially women in midlife. And I'm really glad that you explained why, because I think that it feels really overwhelming that all of a sudden the brain just turns on and won't turn off. So, do you have any tips? I mean, I know that sometimes it's, gratitude journal, breath work. I mean, what are the tools that women can use when they have this, as you said, the leakiness of the brain?
Yeah, I love the gratitude journal. I love breath work. I love any system or behavior that enhances your parasympathetic nervous system. That's the rest and digest. The opposite of that is the fight, flight, freeze, fawn, feign, all of the F's. It's effed up. Okay. So you want to do more in the parasympathetic realm. And something that's changed in the past 20, 30 years is that we all have mini computers in our hands all the time. And it means that we don't have any white space in our brain during the day. There's no opportunity to be bored and for your brain to kind of run some background processes and do some software updates. Like there's a function to being bored, to not having anything to do and just sit there with yourself. But we don't have that anymore until we lay down at night in the dark, in the quiet, and by ourselves. Then our brain wants to come out and do all the things that it needs to do. So I encourage people to take some time for white space during the day. And that can be difficult when we're all so beholden to our to-do list, or maybe I'm just speaking for myself. But do a thought dump onto paper. It's like cleaning out all your kitchen cabinets, put all your thoughts onto paper and just evacuate those things that tend to bounce around in your brain at night. When I coach women about this, I like to point out that we are carrying a disproportionate burden when it comes to our thoughts and our responsibilities. And if you're awake in the middle of the night, can't get back to sleep because your brain is so busy, notice that there tends to be a theme. The theme is often not safe, not enough, or not congruent. So something is amiss, and often it's like an issue, like your head doesn't agree with your heart kind of thing. So during the day, take some time to write down things about that. It serves two purposes. One is it slows your thinking down, which is an antidote to anxiety. The other thing that it does is when you get those thoughts out onto paper, it allows your logical, deliberating brain to say, oh, no, that's kind of silly. That's not a real fear. I can reassure myself that that's not going to happen. It's okay. And now you have kind of a touchstone to draw on if that comes up for you at night.
Oh, such good tips. I love it. All right. So how can women connect with you? I know you have a book. I know you have, a clinic and a coaching practice. So how can they find you?
Book is in the works. I would love to connect with women on a coaching basis. I actually coach professionals, including physicians, high achievers, attorneys, etc. You can find me at awellsmd.com. And I also have an online information and education platform for people with sleep apnea. That's at supersleepmd.com.
Wow. All right. Thank you so much for all you're doing for women, for people who struggle with sleep. I think it's just such an amazing service, and because sleep is the fundamental part of everyone's health. And so I just appreciate you so much and everything that you're doing.
High five right back at you. I feel glad that I can collaborate with people like you that are in the same line of work, and really promoting sleep health is so valuable. So thank you to you as well.